Hi, my name is Sherry Noffi, and I'm the Director of Patient Care for Loma Emergency Department. Today, I'm here to introduce to you this fantastic process we've implemented, the Stoplight program. This is a program that we use to just pause for a quick second to make sure we're getting all the vital information from pre-hospital. Our trauma surgeons, our ED attendings, our nurses, and also the paramedics talk to get all the information they need from pre-hospital. This is allowing us to provide the best care for our patients and the best outcomes.
The Stoplight approach is basically an all-stop when we deliver a patient to the emergency room, so the staff could give their attention to the incoming paramedic to gain a good understanding of what we have done in the field for the patient and to deliver a better treatment overall in the emergency room.
The Stoplight approach is a way to improve communication. 20 seconds for the whole team to get into the room, which means, hey doc, it's time to come in, the patient's here, because there is sometimes when they're seeing other patients as well. It's a time whenever all of the providers get into the room at the same time. For the 60 seconds, it's time for the provider to give the information. Doesn't always take 60 seconds, but when it does, it's important to listen to the entire report and make sure that we understand what is happening with that patient. And that last 30 seconds to ask questions. So if anybody in the room does have questions about the care of the patient or what happened prior to arrival, that's our 30 seconds of wisdom.
This is Loma Linda Base.
Minutes out, boarding of a 22-year-old female. She's at Glasgow, 50. Got called out to Apple Valley. Currently, she was the ATV unhelmeted, lost control about 30, 35 miles per hour. Ended up end over the handlebars. Landed on her face. She does have some significant swelling to the right side of her face with a lot of abrasions. Unable to open her right eye. Apparently, for bystander, she was out for approximately 1 minute and did come to. She had a total of 2 episodes of LOC before she's been in Glasgow of 15. Does have some alcohol on board. She also does have some abrasions to her chest and also her right arm.
Alright, before we move the patient on the bed, we need to stop for a report.
She's 22, coming from Apple Valley. So per EMS, she was actually riding a quad. She was non-helmeted, lost control of the quad about 30, 35 miles an hour, ended up end over end. So she landed on her face. Positive loss of consciousness. She's got a significant amount of swelling to her right side, unable to open her right pupil, her right eye. Also unable to really open her mouth to really assess her dentation. But she's been alert. Per EMS, she did have a positive LOC. She was out for approximately 1 minute. Okay. She had 2 episodes of that. She does have some ETOH on board. She's able to maintain her airway. She does have some abrasions to her chest and right arm, but everything else is unremarkable. Stable pelvis, belly's been soft, clavicle's been equal to palpation. Sugar was 111. She's got 2 IVs, 220 gauges for you guys, and no history of meds, allergies. So.
What was her last blood pressure about?
141/77.
Was she tacky at all?
Nope, not tacky at all. Yeah.
So there's an initial loss of consciousness, and then they said that there's another loss of consciousness?
Yeah, so she had a total of 2, and each time lasting about a minute.
And this is so during your guys' transport? Then?
No, she's been alert for us.
Okay.
Yeah.
All right. Cool.
So no complaint of pain upon palpation to the pelvis or anything like that. So.
Okay.
Yeah.
Any other questions?
No. 1, 2, 3.
This IV came out over here.
Okay.
Before Stoplight, it was you just have so many bodies in there, and everyone starts trying to put the patient on the bed, and everyone's doing their own thing, and it gets really loud. It gets very noisy in there, and a lot of the times the medics would have to almost scream over all the other stuff that was going on in there. So what would happen is a lot of times the medic would just step out, or move away because obviously it didn't honestly sound like they were being listened to sometimes.
The benefits of stoplight approach is to let the AMR or Mercy Air give report and not get interrupted in between all of us doctors, nurses shouting out questions about the patient, and it just gives them some time to get their whole story out before they leave and we know the whole story.
I think the most beneficial thing of this program is a streamlined process when it comes to giving a report.
Helps improve communication in the emergency department.
I think communication definitely has improved. We're able to get a painted picture of what happens in the field, which is very important for us to know, and I think things aren't getting missed that may have been missed before.
I mean, there's been times in the past from other hospitals where they missed a certain laceration or a entrance wound or something like that, and they've missed it on the head, and they're like, hey, how come no one told me? It's like, oh, the medics gave report to one person, but then no one else heard it.
It definitely has helped communication, and what it does is just shows a mutual respect for that report and how valuable it is to us as hospital providers and for EMS to give us that report. It's important to hear what they have to say in regard to the patient, and again, it's patient-centered, so that's where we want to go with this.
What I dislike most about the stoplight approach is the fact that it takes more time to get into the patient care. If we were to have maybe one person instead of 10 people working on a patient at once quietly while the medic is giving the report, I think it would work a lot better instead of having no hands on the patients for that duration of time.
Closed loop communication, that's what I would do to improve it, is when someone says something, someone verifies it. Someone says it, clarifies it, or read it back to you. That way everyone knows what's going on as far as giving a medication or even an assessment. Like, those are very important.
Some of the areas of concerns that come to mind would be maybe just it's a new program, it's not the norm. I think some of the staff may not be used to it, and their reaction is wanting to jump in and do work. And having to have that moment of silence to listen to the pre-hospital personnel is new, so that's going to be a learning curve for everyone, pre-hospital and emergency room staff.
I actually don't dislike anything about the Stoplight program. I think it's a great thing. I have seen it improve communication and relationships between both sides.
I don't think I need to have the power to improve communication. I think it's already given to us, and it's in each one of us individually. And I think that's the biggest reason, and I said this before, but that's why we were given 2 ears and 1 mouth, because it's more important to listen than it is to talk. We lose information if we continue to talk over people, and we will actually gain more information if you just listen. I am a perfect example of somebody that talks way too much and doesn't listen enough, but it is one of my goals as a person to listen more.